or or when did you realize that COVID would disproportionately impact Black Americans?
I mean, I already knew that it was going to. I mean, before all the data came out, you know, as part of my education, I'm doing a lot of research into social determinants of health for the nation and Oregon and Multnomah County. And so, you know, here in Oregon, especially in Multnomah County, which is where a large concentration of the Black community is, our people are already performing poorly on every social determinant of health here. And so, knowing that, knowing how vulnerable the population is here, um, I already knew that that was going to happen and that that data would come out.
Time we spoke, but can you lay out like what it looks, how patients experience racism in a clinical setting? Like what's give somebody who's coming to this, uh, without any knowledge of that, a sense of what that looks like?
Well, I would say just right off the bat, like I this year had to take advanced pathophysiology and pharmacology. And in these textbooks, there's all this discussion around higher rates for cardiac disease and diabetes for Indigenous communities and for Black communities specifically, and increased risk for stroke and all of that. And so when I was reading my textbooks, there's all this statistical information about these health performances, but there's no discussion about systemic racism being the culprit. And so if I were a medical student, if I was in medical school in some kind of rural area and I'm reading this textbook, I may really be thinking that the reason this is because my textbook isn't telling me, is because they're lazy, or Indigenous and Black people are just lesser than, because that's sort of foundational to our country. And so if that is your framework and your lens as a provider, and you don't understand how policies and systemic racism has created this very uneven playing field that has created, food deserts in communities, then you just blame that person. And so I think that that is, as a patient walking into that health system, you just don't know how your provider, especially if they're not of your culture, is going to interact with you. And so you may not tell them important information about your health status or whatever disease process you have because you don't trust them. People,
because they have already exhibited that they blame you and fault you.
Yeah. We all know. I mean, what it's like when you go to see a provider. If they're listening to you or not. Like, you feel that, and providers are people, right? They have good days and bad days. Like, our health system is all about quantity and making sure that, you meet those metrics for how many patients you see in a day. That's a lot of work. And it's a lot of work to walk into an exam room with your whole self, meeting this person and their whole self, and taking the time to engage in that trustworthy relationship and dynamic. And
if I don't much like going to the doctor with several layers of privilege on my side. So
right. And if you're you can't afford to take your medication the way that it's prescribed to you, that there's a lot of shame, I think, in how our marginalized communities manage their health. They know that that they are struggling with it, but they don't know how to, they're afraid to express that to their providers. They're afraid of that judgment and, well, you're not really going to help me anyways.
Some of the statistics that I've recently seen on the outcomes for Black patients with white doctors versus Black doctors are heartbreaking. Like, actually, like, I don't know.
Yeah.
They're appalling.
I mean, I have actually heard people say things like, Black people don't feel pain. They have a higher pain tolerance.
In what context was that kind of comment made?
I mean, I originally was a labor and delivery nurse for 10 years. And so, but when you look at the data, Black women are notoriously undertreated for their pain. Not just Black women, but Black people in general. And there's this stereotype that Black people have a higher pain threshold, or that they're drug seekers, right? Most of our sickle cell afflicted are Black people. And how you manage a sickle cell crisis is giving them a lot of pain meds. The people are afraid of that.